Hello, good evening, and how are you? How are you day? Okay, should I speak pidgin or not? Okay, pidgin English. How you day? Welcome. It's another Sunday again on Ask the Doctors program. Now, this program holds every Sunday by 8 p.m. West African time. My name is Frederick Unubohai, and I'm privileged to be the host of this program. Today, we go to talk about something very interesting, and we're going to talk about hygiene. Now, if you do watch this video after we don't end, like this, you're watching this video after we have ended, I'm sorry, we might not be able to respond to your comments. You understand? Because I noticed that most times when we're done with the live session, some people drop their comments and we can't respond to them. So in case you're watching this video and we have ended, I'm sorry, we might not be able to respond to you. But if you are live with me, you're watching me on Facebook or you're watching me on YouTube, drop your comment. Where are you watching me from? I'm also live this evening on TikTok. I'm just live on TikTok. Hopefully, we can get one or two comments from the people watching me on TikTok. Yeah, tonight we are talking about hygiene. Yes, hygiene and who they watch me, who they watch me on YouTube, who they watch me on Facebook. How are you? Where you they watch me from? Oh yeah, good evening, everybody. Yes. You do welcome. We dey talk about hygiene tonight. So tell me, where are you watching me from? Some people they watch me on TikTok. So let's see. We're gonna take maybe one or two comments. You understand? But if we can't take any comment on TikTok, we will end the TikTok live and face the Facebook and YouTube. Okay, let me see. I have a comment here. Charles Moses on Facebook. Charles, how far? Somebody says he's watching me from Kuwait. Okay, Salamatu watching me from my network they seize. Ah, okay. I will have to change my network because this network they mess up right now. Okay, Israel, how far? Can you hear me? Okay, let me bring Dr. Israel up. Dr. Israel, good evening. How you day?
I'm fine. Good evening. Happy Sunday. Happy Sunday to everybody.
Yes, happy Sunday. Welcome. So we get Destiny. Destiny is watching us on Facebook. Sonia Godwin is watching on Facebook. And then who again? Who they here? Somebody is watching us from Scotland on TikTok. Emmanuel is watching us from the UK on YouTube. Good evening, everybody. Now tonight we are talking about hygiene. Very interesting topic. So before we start, I want may you put in the comment section. What do you understand by the word hygiene? When you hear hygiene, what does hygiene mean to you? Put them in the comment section. And then I go hand over the live to Dr. Israel as I take your comments. But right now, everybody, I want you to tell me waiting you understand by the word hygiene. Now, luckily for us, we don't subscribe for this account. So um, we get we get a month subscription here. Last week, the team been do us shaggy. So, Dr. Israel, over to you.
Over to me.
Hello. Yes.
Hello. Over to
Yeah.
me.
Yes.
Okay. Today we decided to talk about hygiene because we still say hygiene is one of the things that will help us to prevent a lot of disease. And there are different ways when we fit it, keep ourselves in that good health and a true hygiene. And wetin be hygiene? Hygiene na just although any condition or any practice, anything wey you do to make sure say you maintain good health and to remove disease from where you dey or remove anything wey go fit cause disease from where you dey. So that's just a simple definition for hygiene. So we get good hygiene and that's wetin we dey talk about. So now this hygiene dey among one of the program wey WHO even don even don't bring comment, and we dey call that program wash. When we talk about wash, we dey talk about water, sanitation, and hygiene. Eh? Now other things still join, but those are not just the few ones. So when we talk water, sanitation, and hygiene, all of them they talk about how to make sure say person dey in a good health. How you go fit take care of yourself, make disease not enter your body. So that na just the short way to take define hygiene. So when we talk about that, you can see different parts of this hygiene. And one of the part na hand hygiene, make it good, make our hand dey clean. And apart from hand hygiene, we dey get the food hygiene, we dey get hygiene to so many aspects of our life. Now, when we talk about hygiene, we dey talk about mostly cleanliness, just to become clean. So if we fit clean our environment, we go fit keep ourselves safe from disease wey dey spread through dirt, wey dey spread through dirty. So we go fit keep ourselves safe from that. And make I let you know, say just common hand hygiene can save us from about 50% of disease states, infectious disease. When I dey talk about disease, I dey talk about infectious disease. That is disease wey go fit spread from one place to another. And some of the infectious disease, you go notice say every time now we dey talk about a little outbreak. There's an outbreak of this, there's an outbreak of this, COVID outbreak come. Now we dey get Lassa fever outbreak. When be like say that one almost every time, every ending of year and beginning of year, now they happen. And common hygiene go fit help everybody to prevent this this different diseases, different infective diseases when they come. So I think that one I make us just say, okay, today we'll talk about hygiene. Let's just put mouth small for every different aspect of hygiene, so that all our audience, you will be our audience, go see fit know, and you fit still understand things wey you go fit do to make sure say you dey safe from any disease state. Now, even cough etiquette still join hygiene. So as I earlier said, hygiene na very broad thing, but we go just try talk am small, small. Okay, Dr. Fred.
Yes, thank you, Dr. Israel. Good evening and welcome. If you just join us, welcome tonight. We talk about hygiene. A lot of people no know say just simple hygiene tips go help you live long. And I be dey ask question, say wetin you understand by the word hygiene, and Dr. Israel don't break them down for us. Now some of the things that we dey do to stay clean to help us prevent germs and infection. Wherever you dey watch us from, you dey welcome. So if you ask us any question wey no dey related to hygiene today, we no go take your question. Today's topic is strictly for hygiene. You understand? Yes. Now, Dr. Israel spoke about personal hygiene. Under this personal hygiene, we get things like bathing, we get things like brushing, and the rest. So we go break down personal hygiene because we get one thing where I don't notice. I don't know whether Dr. Israel too don't notice this one. Some people we get some kind of sicknesses where they get, and those sickness not just because of their hygiene. Example, hand washing. People go toilets, they no go wash their hands. When they come out from toilets, they go eat food. They will come, they vomit, they get abdominal pain, they go toilet, they get diarrhea. They will come, they blame, say, na infection where I go toilet, not knowing that simple washing of your hands can help you. Before I continue, I beg everybody, share this live so that more people go come join. So let's talk briefly about personal hygiene. Then we go talk about food hygiene. Then maybe we go talk about few benefits. We go open the floor. We go take question. Dr. Israel, more talk about personal hygiene small.
Okay, when we look at personal hygiene, before I even talk about personal hygiene, let me just talk one broad thing is that now this hygiene is not just one person thing. Now our thing, now all of us thing. So this will not be say now will they give you so that make you know say yes, you still get parts to play when it comes to hygiene. So when we talk about personal hygiene, you always go see talk about your environment, because if your environment not dey clean, you yourself no go fit dey clean. And hygiene no go fit dey possible where water not dey. Eh? When we not get enough water, good water, more fairly whether the water good or not, but water, when water not dey, hygiene go dey a little bit difficult. So personal hygiene and those things wey you go fit do for your own self, when I make we call am personal, when you fit do for your own self to make sure say you yourself not get disease, not fall ill. And even though other persons a bit closer to you get one or two disease, but if you fit protect yourself with these personal things wey you do to keep yourself clean, you go dey save yourself from many of these disease. And one of them, as Dr. Fred don talk, he say some people no go bath or go toilet, they no go wash their hand and all that. So those things dey cause different type of disease state. Now, everything wey we talk, we will say one important thing na hand washing. Hand washing cut across every aspect of hygiene. Hand washing cut across all of them. So the first thing, you need to dey wash your hand. Most of the time when you know say your hand dey, you feel say your hand get one kind, you need to wash am. And most of the time, if you not see water, maybe e not too dirty, you fit use hand sanitizer take make sure say your hand dey clean. So because one thing is that our hand na im dey move go almost every part of everywhere. And this same hand now we see the quick use take dey put for our face. And our face can't get all this mucus level part when we say they tiny, when we say once you put your hand close to that place, disease fit quick pass there, enter your body. So now make it good say we dey wash our hand. We wash our hand, you brush your teeth, you take your bath. Now this time when we say everywhere they hot, like say mostly for those of us where they Nigeria, in Lagos in particular, when everywhere they hot. So dirty go dey skin all the time. And you can't imagine say you know the bath to wash those dirty come off for your body. And another thing, you not wash them come off for body before you know your hand all use and rub part of your body. You don't kind of go your face, don't put them for your eye. Sometimes that same hand, you know, go even remember to wash and you don't carry one fruit, you don't try enter mouth. So with that, we don't cause dirty for our body. But once we fit they try they wash our hands, they always they remember to wash our hands. They try to remember to take our bath at least twice a day if the weather they favorable. But if the weather not they favorable and you get a lot of water, you can take your bath as many times you want. They brush your teeth. It's very good to brush your teeth in the morning and evening, and preferably. So twice a day is also very important. You brush your teeth. I bet your nails, it's also good say maybe we dey cut our nails short, because sometimes our nails now room where all these germs, all this dirty they go stay. And when all this dirty go stay there, sometimes it will feel from there pass and enter our food and every other place. Now we know say we get many places where we fit tell you say if you do this one, you wash your hand. If you do, I don't go talk all those ones because I believe say some of you or all of you feel know most of those things. And like if you go toilet, wash your hand. Before you eat, wash your hand. We dey talk this thing every day. So apart from you cleaning yourself, you also need to keep your environment clean. So because that one still join personal hygiene, not just for yourself alone, also for your children when they're around you. Because when disease states come, it go to make your children they sick. It not go make them grow well. Because and even becoming smart, pikin when they go hospital, you not go sit and take go school, come no book. So these are some of the you just say a simple thing, but this simple thing you still need to do. And another thing is that good hygiene will help you save a lot of funds to take do other things instead of going to seek hospital, go to treat yourself. It will save you from that expensive. Yes, to become hygienic, it's not that easy. It's not cheap, but it's cheaper than treating cheaper than treating disease states. And so when you keep your environment clean, I always they talk this thing, and I go see talker. And most of our elderly people they quit do this thing very well. Well, because they don't old, most of these things where they don't use all this time, they go still pack and keep them for their house. They not go through them. They not go let them go. They go put them for their house and not be said the thing not they work. those things no dey work, they don spoil. But they go keep am for house, e go be like history. Eh? And this thing go come become room where anything wey go fit carry disease go dey come stay. Go become room for mosquito, become room for rats, become room from all the different type of reptiles. And these reptiles fit bring disease to our house. So when you get all those things, all those small small things, you no dey use am again. I don't know why it should be in your house. Your house dey tight, and those things wey tight your house, not be say na things wey dey very important, na old things, even though e never old, but things wey you no dey use. Why not pack those things? If na things wey you fit dash person, go dash
Hmm.
another person, make dem dey use am. If not be things wey you go fit dash person, why not pack those things, go burn them, or you go throway them for dustbin, or you go put am for where ex sanitizer people fit see am, carry the dirty, carry am comot, so that make all of us dey healthy. So that na another way to take keep our environment clean. So you remove all those things wey you know say you no need, and remove am comot from there, so that space go dey. Because once there is space, all those reptiles no go see where enter, because they no go see where hide. And once they know say, this place space too full, and they no go enter that place. And if they no enter, your things go dey safe. Another way when okay, and I think I'll stop here and leave and allow Dr. Fred talk small.
Thank you so much, Dr. Israel. Thank you very, very much. For anybody where they come today na hygiene matter we dey talk about. But before I continue, I want to say thank you to somebody. And this person just sent CC Bay. I see you. Yes, CC Bay on YouTube. Thank you for this level where you send us. It help us subscribe. Thank you very, very much. Yes, I see him. I see him. Thank you much. Thank you so much. Yes. Gift David, you did welcome. Ngozi Amina, I see you. We talk about hygiene. Okay, we talk about taking our baths like twice in a day, especially for those of us where they hot environment like Nigeria. Last week or 2 weeks ago, the weather was very hot. Some people can't they get skin rash because of the environment. Remember, environmental hygiene and the rest. So taking your bath also can help you. But one important thing where we know they talk too much about now, waiting Dr. Israel talk about our fingernails. I see people, I don't know why. I don't know if you dey guilty of this. I beg, put it in the comment section. Why do you keep long fingernails? Most especially for the ladies. I know some ladies like long nails. And then when you want to press your phone, it dey hard you. Now, when you go toilet, how do you clean? When you want clean your body, all those things, now little things where you go do, where go keep sickness away from you. We spoke about taking our beds, cutting our hair. I don't know if you mentioned that one, cutting your hair too, and then brushing your teeth. Because some people, you get sickness, we go do you for your mouth. It will affect you for your heart. Because you no brush your mouth, you get infection for your teeth. This infection can actually affect you for your heart. Me want talk one important one, and wetin I want talk about now our food hygiene, especially for those of us where they live for developing nations, those of us where they buy food for road. Most times you go see somebody where they cook food. The person picking go poo for ground. The person picking go poo near where they sell food though. They go just clean the picking. Some of them know they wash their hand. And we go buy food there we chop. We'll come they fall sick and we go they blame malaria and typhoid. Not even knowing that now just simple hygiene tips will go help us. And that one for food where me won't talk now regarding cooking your food and covering your food. Some people go cook their food finish. They're not go cover them. I like don't worry, nothing they happen. Not knowing that as you know cover that food, you they give that food opportunity for microorganisms to multiply inside that food. When you can't chop that food, if you go toilet, you get what we they call food poisoning. Some people go chop rice. After they chop rice finish, you go here say, I don't go toilet, I go to vomit and they purge because of the food. The way you store your food matters a lot. Before I hand over to Dr. Israel again, I beg everybody, share this live, like this video, invite your friends so that more people can come and watch us. So let's talk briefly on food hygiene. then maybe environmental, and then we could take questions. So Israel, over to you.
Okay, for food hygiene, now Dr. Fredo talk two aspects. And for us, where they buy food for outside, and a good make we know the environment where we for they buy food. You need to check around you before you go there, go buy food. You notice that the place dirty. Another thing when I will talk is that yes, I know say not be you make we fair do our part. I don't want put I dey try not to put uh um external body to this. I just want me we talk about we doing our own part. And so for you, we will try to check around the place where you want for buy food. Dirty full land, if dirty full land, you know say man, that food when you want buy, there's everything there to say you feel the buy salmonella and shigella. You feel the bad disease, the chop. I remember one of my lecturer we talking. So you just carry money, just go all those bad food, you just go there, go buy salmonella by yourself with your own hand. So that's why you need to check your environment where you for the buy food to be sure say that environment they neat and they clean for you to feel buy food. Now cooking your food is very important. Yes, you cook your food very well. Wash those things when you want cook. Before you cook, then you not cook meat half. Say and that's what they say the nutrients they not be so. Let your meat done. Let your meat cook and done because those meat sometimes some bacteria, some things they inside the meat. So if you not cook and done, you feel they eat raw things and it go fit cause problem for you. So your meat should be cooked properly and wash your vegetable very well, prepare it very well because those are not things when they feel quick carry all these bacteria and all these germs when go fit cause problem for us. Now another thing when I will talk is that for us, some persons after they don't cook finish, I don't know whether people still they do it, but I think people still they do it. After they don't cook finish with spoon, and the spoon they'll come put out on top their pot, can't leave the pot. Then the next morning, that same spoon, they will just carry am, put am for the food directly without washing it. It is that thing not good. Because you never can tell wetin don pass through that pot and that spoon when you take leave am overnight. Even not be even overnight. Even you cook use am in the morning, by the afternoon. Wetin I dey do is that once you use am don collect food, throw am put for sink. You know say that one na to wash am so that anytime you want collect food, you are going to use a new one, a new clean one, or you wash that one when you don't fair use, can't use them again. Some people go just abeg na that spoon papa, they no go wash am and e dey wrong. Now plates when you even wash keep, when you don't wash keep, you want use am, it makes sense and it good say when you carry those plates, rinse them again before you use them. Because sometimes as they always they talk this thing, when we dey sleep for night, we don't know wetin don crawl pass those plates. You don't know wetin crawl pass those spoon. So that is the reason why you need to go rinse them. So then now Lassa fever now, most of the time, if it not be from human to human, wetin they carry the Lassa fever? Now rats. And this rat, some of these rats, they house with us. And when this rat, they are piece, they feed up piece for the plates, or their stool fit touch the plate, but the stool fall come off from the plate. Or their leg, they don't use their leg waka put for the plate, and you don't know. You carry the plate because the surface, you see they look and say they clean. Not knowing say things don't they. You carry food, put passa. Then the next thing you say you don't they sick, which is wrong. So try to they rinse all those plates. Another thing I be say for us when they store food, raw food, it go make sense say if you want store raw food like garri, rice, put them for plastic, not be rubber bag, not be all those nylon or bags when something fit chook, when something fit pass tear. Make it be plastic and when get cover wey fit am, not be the one wey be say you dey room, you hear say cover don fall comot by itself. No, cover wey fit the rubber so that you will know say that food, all of them, they safe. So when you dey do all these things, so you are preventing yourself from every things wey fit enter the food or fit make all those things dey get problem. And for us when they see bread, we see bread or any food sef, because e say they don something don chop one part, because e decide say okay, no be to na to just cut that part throway, then eat the remaining part. Sometimes just cutting that part throway, e fit no help you. E fit no help you. It's better you keep those food for where those things no go see the food chop one part. Or if you see say they don chop one part, just carry dash dem the full part. Then you fit go get your own. I know say economy hard and people go talk say economy hard, why you go just say make I just dash dem, but it's for your own good. You know, e better say you give you throway 100 naira than later you come go dey spend 5,000 naira for one single drug. Because now medication dey very very expensive. Healthcare dey very very expensive this period, mostly for Nigeria. If anytime I dey talk based on Nigeria, so mostly for Nigeria. So healthcare dey very very expensive this period for Nigeria. So we need to dey very careful make we no go fall victim of taking a lot of medication, spending a lot of money for small small things when we go fit prevent. So when you dey do all those things, and your kitchen where you dey cook, e no suppose dey very close to dustbin, dirty place. It must be a bit far from it. And also you need to dey clean that place well well. You also need to keep that place make e get space, so that things no go fit go there go dey hide. And let everywhere wey you dey keep things dey clean. As I earlier said, water na one thing wey we no go fit talk away from it. So if you wan even start to dey cook, e dey very very good make you first wash your hand before you start to dey cook any food wey you wan cook. Yeah, Dr. Fred, over to you.
Thank you so much, Dr. Israel. Omo, this matter wey we dey talk, it looks so small but very big. Dr. Israel mentioned something about bread. Make I throw more light. How many of us don't put bread for house? And then one day you go look your bread, you can't see some kind things on top the bread. You can't be like, the bread on the spoil, but make I cut that part on top of the bread, make I cut and away. So man, let you understand what happened to that bread. Cutting that part on top never save you. Some people go cut the upper part of the bread and they go chop the other part, it will give them problem. That thing where they see on top of the bread, now fungi. And those fungi, they are inside of the fungi, long. So their body long inside the bread. The one where they see on top, now just small. But inside the bread, it don't spread for them to get enough leg inside. So if you cut the bread for the top, say, and at this part, now don't they spoil. The other part inside never spoil. Actually, you they chop fungi, and if it give you problem because the other part inside the bread, your eye no fit see am. So when you they protect your food, all these things now things make you look out for and make you take note. No be say, now only one part now spoil now, or rat chop your bread, and you talk say, and no be just small part. You can't go chop the other parts. You fit go use and spend money for hospital well. Now this one, nine. When somebody says something, I seen it before and I threw away the whole bread. Our people go talk, say, why you go throw away the whole bread now? Things hard. You know, say, if you no throw away that bread, you go chop it cause problem. Money where you go spend for hospital. Hey, your eye go see win. Okay, so we have some comments here. Somebody says what? Say, some will say it's food poisoning, not knowing that simple hygiene would have saved us. Sometimes no be person put anything for your food. Now the hygiene where you no get. Okay, let's see if we have questions here. So if you just come, we dey talk about hygiene, simple things where we go do to help us for our hygiene. We've spoken about personal hygiene, how to clean, taking your bath, cutting your fingernails, brushing your teeth, and the rest. We've spoken about food hygiene. Dr. Israel was very particular about you. But I noticed something, say, sometimes as an individual, I go try to keep my hygiene. but somebody else where they near me, he go put me for problem. Like maybe somebody else go cook something or do something with this spoil my hygiene. So in as much as we're talking about ourselves, I feel our environmental hygiene they important. Example, where we they live, mosquitoes. If your environment no they clean, you as an individual you they clean, but where you they live, people where they live around you, water day, bush day, stagnant water, mosquito go they follow you live, and then you go they talk say I they fall sick every time. So I feel with this little time we get before we go come take your questions on this topic, when we talk about environmental hygiene, like keeping your environment clean. One thing where they pay me well, well, thank God, man, talk about them. Now, for this part of the world, people go they throw away their dustbin inside gutter, inside gutter. So you will see them, they block gutter. Everybody, most people they do them, they pour dustbin inside gutter. And then when rain come fall, there is no flow of the water, everywhere block. We go come they cry. Hey, hey, rain don't follow, water no go. But now we, everybody, some go look am throw away their face, but now we they throw away our dustbin inside gutter. They block all these things. Then when rain come fall, water go overflow enter people house, infections and mosquito go come play. So we'll talk about environmental hygiene quickly. Okay, over to you.
Okay. Before I talk that environmental hygiene, because environmental hygiene now now our you know the first time when I said this hygiene now our business. So when we talk about our business, it means now when we talk about us, we dey talk about community. So environment, we talk about the community, how to keep the community in a way clean. So before I talk that, I want to talk one thing about personal hygiene when I think say I forget. Now cough. I know I say we get what we call cough etiquette. That is how you're supposed to do the cough. So most of us, sometimes you dey public transport, you just open your mouth, wow, just spread things. It not make sense. Either you cough into your short elbow, inside your elbow, or you get disposable tissue or hanky, disposable hanky. You cough put and you put them for where you supposed put them. Now, down are just for down are for that. And it's not good to use hanky, normal hanky take the cough. When you use a cough, sneeze finish. Now inside your pocket, you see go put them. Now still that same hanky, you see bring come and take clean your sweat. Now still that hanky, you take clean your eye. You see how you know say you don't spread disease for your body. So that's why we know we that one we try to discourage you using your hanky for your sneezing, your coughing, and all that. It should be anything disposable or you cough into your elbow. Okay. Now that one for that. Now I want to talk about environmental cleaning because our environment, if we not see keep our environment very well, it go still lead to the spread of disease. Because if water gather for our side, that one na go make mosquito fit the breed. And if mosquito they breed, you know wetin that one will cause now because now then they carry wetin they cause malaria for us. Not be saying that they cause malaria, but now they carry the parasites where they cause malaria. So that one will they give us malaria. And apart from that, you know, when you don't gather dirty water, all that bacteria go physically grow for there and it will cause things for us. Now, where you dey throw away your dustbin also matters a lot. When you don't allow your dustbin, it don't grow, it don't swear. Then fly go come they enter those dustbin. When you don't enter those dustbin, those same fly go come fly, come perch wetin you keep when you refuse to cover your food wey you keep when you refuse to cover, you come perch am. No, remember say they don't go use their legs take put for those dirty. They come carry those things come put for your food or your surrounding. It will physically cause disease and dirty for you. Now, as Dr. Fred talk, he talk that one say some people go dey throw their dustbin for inside gutter. Inside erosion, they say the water they flow, would just throw the dirty, make it flow and come on. You forget, say it get where it go flow reach, it go stop there. And when it don't stop there, you go they gather there. Then later, the next thing you they see now, water no go come they fit pass there. And once water no fit pass there, there don't turn room where all these bacteria, all these things when fit carry disease go there, go they feed, and as they feed, they ready to come, they ready to come harm us. So we too go play our part for our community by first of all stopping those things and try to make sure say our own side of the gutter dey very good. Our own surrounding bush not too close to us, because when bush take very close to us, that go make all these rat and all those things they enter our house. Or you dey stay near marketplace, you dey stay near marketplace, in fact you need to do a lot of work for your environment. If possible, if you fit even get the opportunity to fumigate your environment, e not bad. E not bad. That was now part of keeping your environment healthy. Those are part of keeping your environment healthy. So you go try to make sure say water no dey gather for wherever close to you. Even though water wan gather, make it dey very far from your environment. Sweeping your environment is very important. If we don't talk about grass, we need to clear, and also we need water for our environment, because to even keep all these things when we dey talk, water dey very, very important.
Important. Thank you very much. Water dey very important, because for where water no dey, get wetin they call waterborne diseases. You go dey see people go dey get skin rashes because no water. People no fit use water bath. They no fit use water wash their clothes. You go dey see skin rash, skin problem. People go dey fall sick because they no fit see clean water drink. That is why we talk say more we talk about this topic. But before I continue, make I just put am for here. I know say some people dey watch me. I say I'll let you know quickly. We go come up for this matter. On the 1st of March, we go do our fruit challenge, announce the winners. 8 p.m. live session. So if you know, say you do the fruit challenge, you post video for your page, you tag me on the 1st of March 2024 by 8 p.m. in the evening, Nigerian time. We go do live session and we go announce all the winners. So no miss am. Yes. Back to our discussion on hygiene. When we talk about some of the benefits of hygiene, if you get good hygiene, you know, it gets some people that go sick, come hospital. Doctor go tell them, say, Madam, you don't get any problem. Wetin you just need to do now, improve your hygiene. The way you dey clean, the way you dey wash, just improve them. So one thing where good hygiene go do for you, be say, it go help you prevent infection well. All these sickness, abdominal pain, bless I won't vomit, I dey get malaria, typhoid, and all this stuff, it go dey far from you. Now, one huge benefit of having a good hygiene, because people will get good hygiene, just like Dr. Israel talk, you dey cough, you dey cover your mouth and your nose cough. You go notice say people around you know they cough. But in this part of the world, somebody go one cough, he go open his mouth, share the cough, give everybody. And then the next minute, somebody else they cough. So having a good hygiene reduces the amount or the burden of diseases in our environment. Make a hand over to Dr. Israel. When we continue, then if you get question, drop your question in the comment section, and we go try take your questions. Don't forget, share this video. If you get stars, send all stars on this live session. If they watch us on YouTube, you can send super chats, you can send super stickers. God bless you. Dr. Israel, over to you.
Okay, some of the benefits for good hygiene, as Dr. Fred talked, the first one, it will reduce disease. One, for yourself and for your environment and for people around you. Because if you dey healthy, if you feel reduce disease for yourself, you at that point you don't become, you no go fit spread am to others. And if others are not get, it means say you dey protect yourself and others. And remember, Dr. Fred talk one thing, say when you feel a cough, cover your mouth, cough very well, you go notice say people around you not get the cough. But if you not do the right thing and people around you get the cough, when your hole heal, because they get the cough, maybe they not still do the right thing, they go give you, wait till say you don't well, they'll give you the cough again. So you go start with the cough. Then the cycle continue. But one, it reduce disease condition. Another thing, it will also help us to reduce our financial burden. It will reduce our financial stress, because when you dey protect yourself very well, the little money when you supposed to chop good food, to do all those things, you can't go use am take dey buy medications. No go too dey okay. But with good hygiene, it go help us still save a lot of funds. So we not go dey fall sick. Because we not fall sick, we not go spend a lot of money. Now, another thing go also make us dey very productive. Because when you are not sick, it means say for those wey be students, they go fit go school. They go fit come become wetin they want be when they finish school. While for adults, it go make you fit go work. Now imagine when you get flu, or you get you are down with stooling and vomiting, gastroenteritis.
Yeah.
You are down with gastroenteritis. When you dey run, they go toilet, they come out, they run, they go toilet, they come out. You no go fit go work. For that day, all the money wey you suppose fit make for that day, you no go fit make am. So, and you will not be productive. Even your company, if now maybe they work for people, that aspect of your work will suffer for that day, and because of that, you are not productive. eh and if you are not productive, you are not helping yourself, you are not helping the nation at large. So with good hygiene, you protect yourself, you reduce illness, you reduce your expenditure, and you will be productive. In fact, if we say we dey follow one after the other, you'll see say just hygiene it has a lot of benefit following that the train when I just dey follow. And it not just the only they help you. Being having good hygiene, not just the only they help you, but it dey help the society at large. It dey help the society at large. And make we not go physically remove the society away from this hygiene when we dey talk about. So we need good water, good water supply, good disposals, waste disposal organizations, and all that. And even though in quotes, I don't want to talk about this thing before, but I need to just say, even though the government not go fit, even though the government not dey fit do all these things, we ourselves will fit plan them in a way when we don't say yes, it will benefit us. And good hygiene, and when you do am well, it go help our children at large as well. Thank you, Dr. Fred.
Yes, I like this part with Dr. Israel talk. Good hygiene go help and help our children. I notice say parents will get good hygiene, that they pass them to their children, because parents will sabi wash, cut fingernails, they pass them to the kids. But you go see some parents, I don't want to talk like I don't want to go. They know they take hygiene seriously. The matter they also show for their picking body. You go see them, the kids too know they learn. So this thing now waiting with it pass onto our children. Make I read one or two comments here. Make I see. The person says, I they still wear my face mask, but people go they look you somehow. They go they look you now. Remember that period of COVID? Everybody just they panic. Um, Somebody's asking a question here. Doctor, how long do you have to use that is your toothbrush before you change it? Dr. Israel, go answer.
Yeah, and we know say they say 3 months, use them for 3 months, then you change it. You change it and get another one. Now, sometimes one thing what you need to know is that if you really they use toothbrush when good, when you don't read that 3 months time, you will notice say the toothbrush itself don't change. It go just change one kind, go in the toothbrush itself go they do like say it not be toothbrush again. So you should know say it don't reach time to take change your toothbrush. So 3 months, within every 3 months, you are supposed to change your toothbrush.
You don't hear the answer. Every 3 months, advisable to change your toothbrush. Okay. If you get questions for us, No forget to drop your question in the comment section. Another thing, one other benefit where hygiene fit do for us, we say it dey also prolong our lifespan because you notice say when you know they fall sick often, at least by the grace of God, all things being equal, the lifespan they increase. But person wey dey fall sick, fall sick, fall sick, fall sick every time, the quality of your life self go dey reduce. Imagine person wey dey enter hospital every month, every month, every month, every month. You no go dey enjoy your life. Your life no go sweet you. You're always falling sick. And again, they also give the person, they prolong the life. You can live long compared to somebody maybe say they sabi purge, they eat anyhow, they wash in food. You get one thing wey Dr. Israel mentioned, and I think I have to mention it again or re-emphasize. Now, for the kind of food where we they cook, I know people when they cook their meat, they know they cook and make it done well, well. When they cook food, they know they cook and make it done. And you know, say inside some of this food, sometimes microorganisms fit dey inside this food. And if you know cook am well, you know cook and make it done, and you know kill these things. These things fit enter your body. Some of them fit go hide inside your liver and cause you problem. So when you dey cook your meat, and they say make we steam the meat, make it no boil, make it sweet. Cook your food very well because it's among food hygiene. All these what do they call food safety and the rest. Okay, any question? Dr. Israel, any other thing to add to this topic as we go dey take question?
Not nothing much to add, but I would just want to say let's always keep uh, our hands clean. Eh? Hand washing is very, very important because now that one will help us reduce a lot of disease. Hmm? That one will help us reduce a lot of disease, like almost 50% of disease will be reduced with just hand washing. So make we wash our hand very, very well. They very, very important.
It is very important make we wash our hand though. Many sicknesses can be prevented with hand washing. Somebody they ask me, can we ask any other question outside of this topic? No, no, we no go fit take question when we know they like comot for the topic. Any day we dey do question and answer. Now that time we dey answer different questions. But if we get a topic, we dey stick with that topic. We know they like comot because if we comot, everybody go follow you comot. Go come they ask different. So we dey like stick with the topic. Maybe during the week, if I fit dey online, maybe, or any day we do um question and answer section, you can ask us your question. Again, let me just put this one here again. I say make I see they let us know. One thing where we they do since now fruit challenge, and some of our sponsors don't talk say make we do this edition live session to give out the prize. So everybody will participate in the fruit challenge. You do video, you post them for your page, you tag me on the 1st of March by 8 p.m. Nigerian time. I go there live. I go announce all the winners and the money where we go give out. Some of the sponsors are here, and I also want to say thank you again. Some of the sponsors and to everybody we go like win the prize. Go and download or go and register your OPay accounts. OPay, I go use send that money. You get why? So that OPay go fit sponsor us next time. Yes. Welcome. If you get questions, please ask us. I have really missed you guys. I see you. Somebody's asking a question that is not related to the topic, so I'm sorry we cannot take your question. I'm sorry. So it says yes. Now, why strong immune system? They good. Yes, very good. Strong immune system. They very important.
No, no, no.
Let
To
me.
get strong immune system. Sorry, Dr. Ferman, I don't know why this person said this, but make I if within my mind they tell me make I talk this thing, make I just say one or two things. Now you fit get strong immune system if you can't decide say you aren't going to you not gonna keep your environment clean, you not keep everything clean. That your strong immune system will turn to weak immune system. So
Mm.
having strong immune system is very important, is very good, but your hygiene will also help your immune system to remain strong. So that if after you don't fit do all these many things when we talk, then small disease can still find a way to enter your body, then your immune system go fit fight them off. But if every seconds, every minute, your immune system they fight, they fight, they fight, it just be like soldier wey you send go war. When they fight, they fight, they fight. Wetin go happen? Some of them they die, and as some of them they die, if you not replenish them, they reduce, and then you can't get weak immune system. So make we know this thing. So the way we will fit they replenish our immune system, and just to keep your hygiene very clean. When you keep your hygiene clean, and most of your immune soldiers when they your body, what they call the immune system, the white blood cells, they go they intact, and they're not going to see many fights to fight, and that will make us remain healthy. Yeah.
Thank you, Dr. Israel. Good evening, Agbesi. Okay, there's a comment here that is not related, but let me take it, please. You get why? It says, Doctor, I don't know why I can't pay direct for Telegram. Please, can I pay and send receipts? Okay, let me address this. You get why? Okay, so I get a private Telegram channel, Telegram membership. People subscribe to join. Now, the reason why you can't pay direct to my account is because the link to join is when you subscribe and pay. You understand? It dey inside the process of registering and paying. Hmm? I beg, no vex. I don't know why. Maybe na your card or na your bank. I don't know. I won't lie to you. But try it again, because when you subscribe, you pay. The Telegram link, the way that we take arrange them, it dey inside that place when you pay. So download your Telegram on your phone, try again, and when you subscribe, automatically you will see the link to join. No be say people they pay direct to me. I beg. Now through the setup. Let me address this for you. And any other person where they watch me, we won't join my private Telegram. Now subscription, you can't pay direct to me. Only when you subscribe with your card, download Telegram, then you can join. Cecilia Gabriel, I'm so sorry. So check your card or ask somebody to help you. No vex. Thank you very much. Okay. Concerning the immune system, Dr. Israel has addressed it. Because you get good immune system, no means say you would allow your immune system to fight up and down. Your immune system can just one day, you go just tire, and you go get power again. Any more questions for us on hygiene? Again, so we won't ask us, please, ask us right now. Make we address them. Our main goal on this channel, on this platform, now to give you those little tips we will help you live healthy life. That is why we know they treat online. We know they give people medicines. We know they make diagnosis. Now just to give you one or two things we will help you. But if you get any sickness for your body, our advice for you and make you go hospital, follow your doctor talk. That is our advice for you. Okay. If you get question, please I beg ask us. No wait when we don't finish. Then you can they try. We have a comment here. He says, "Well done, doctors. You are doing great, sirs. Thank you, Mr. Alasukomi." Let's see. We have a comment here. We do. Beauty. Okay, beauty. I see you. Don't forget our fruit challenge. We're going to announce the winners on the 1st of March by 8 p.m. West African time. Live session. Okay, no more questions, no more comments. Omo. But Israel, this question sweet to
Yeah.
them for body. They don't ask us anything. Please, doctor, can you send the link? Agatha Ifoma, just go to the title of this page, this live session. Just go to the title of this our live session. You will see the link there to subscribe. The title of this live session, you go there. The reason I'm saying this, because we they do private consultation, no. Because they do and me, I they do them. But for the private subscription, the link get as it be. It there on the page. You will see them. No, they hidden. Yeah. Okay. And now, as we do a recap, ladies and gentlemen, as we prepare to round up tonight, we tell you about hygiene. Say hygiene now those things where you go do, We go help you dey clean. All those little things we go help keep infection, germs away from you. E no dey good make person dey fall sick every time, every small time. Person go dey tell you say I dey sick, I dey get malaria, I dey get typhoid. It's abnormal. So we can't decide say may we tell you about some hygiene wey go help you, how to help yourself. Number one, personal hygiene, hand washing. Your fingernails, if you get long fingernails, that fingernail, organisms fit dey hide inside. You no go know. You go go chop eba. One day e go give you problem, or you go toilet, you no go wash well. The thing go do wetin? E go enter your body. Another thing again, na your bathing. You dey bath, you dey brush your mouth. We spoke about food hygiene, how you dey prepare your food. If you no dey cook food well, your organism for the food, e no kill am finish, you go chop am, go give you problem. We spoke about covering your food. We spoke about washing your fruits or your vegetables before you cook them. We spoke about environmental hygiene, your waste. If you get dirty around you, you can't keep them from your environment. You know, throw away them. Mosquito, fit gather, born pikin for those water around you, all those bushes. Every day you go dey fall sick malaria, but you no know say na you dey train mosquito near you. They be like your brother or your neighbor, your sister. You understand? These are some of the things you can do that can help you. And then Dr. Israel mentioned something about your coughing. When you want cough, they cover your mouth, cover your nose, cough. When they cough, they dash people everything where you want cough. And then somebody can talk say that is why you must have a good hygiene. Because your body gets good immune system, no means say you go dey live anyhow, because get how sickness go knock you, your immune system go weak, your immune system go abandon you, body go tell you. So because you have a good immune system, no means say you go dey allow infection to enter your body anyhow. Now let's take a few comments and then we disappear. He says a medical practitioner said the primary origin of typhoid is from human feces. How true is that, Dr. Israel?
Okay, and when we talk about typhoid, it's caused by one bacteria, bacteria what they call Salmonella typhi. Yeah, Salmonella typhi, and this thing we feel with they call transmission of this bacteria fecal oral. When we say fecal oral, we mean from stool to mouth. So when we say stool to mouth, it doesn't really mean saying that your physics or your shit now they mean dirty. Eh? Dirty, the bacteria they follow dirty. Yes, you fix this thing for your stool, because even when we want to do test, when we want to do test for this patient to really know for typhoid, now stool MCS, and we'll carry this to go lab, go check am. They will come see the salmonella. Now we fit also say yes, this person get typhoid fever. Yeah, we fit still use blood though. Now we fit also say this person get typhoid fever. So now make this the doctor tell you say now through the feces, because yes, it is present in the feces. And when you people go toilet, you don't still finish. You wash or you clean, and you not gonna wash your hand. If those things don't enter your fingers, and maybe depends because you get long fingers, if those things don't enter the fingers, if you transfer the thing to your food, and when you enter your food, you can't eat and person get typhoid. Or maybe you can't go buy food for where the people where dustbin near the place where they sell food, or picking just shit near the place where they sell food. The woman self not pack, not clean the place, not pack the shit, but they cook close to her. So things fly fit perch enter that thing and perch enter the food, and we then when we go buy her, we physically get her from there. So the what your medical practitioner talk is on point. It's on point.
Yep. In addition, make I add one other way where people they get typhoid. It gets people where we they call asymptomatic carriers. These people then get typhoid for their body. And this typhoid, not they give them problem, but them they cook food for you. So this type of people will get the thing for body, and when they prepare food for you, they can actually transfer them from their own body, enter the food, and you go chop them. But they too also got it through fecal oral from mostly the fecal route. visits to their body. But then maybe they can't take treatment, the thing can't hide inside their gallbladder, they can't sit down for there. One way they will cook food for you, go carry and give you, and then you go fall sick. Is malaria from hygiene or just mosquitoes? Malaria is mostly caused by mosquitoes. Waiting make us talk about hygiene. They say if you don't get good hygiene, good environmental hygiene, your environment fit be place for mosquito to dey develop, to dey born pikin, to dey grow. So your hygiene too can influence you to dey fall sick of malaria. No be say because your environment dirty na make you get malaria. Na say the environment dey let mosquito grow, hide, born pikin. When dem don born pikin, dem go come find you, come suck better blood for your body. That is how environment. And then this last question as we round up, how often should one fall ill of malaria and it becomes abnormal? 2 weeks, 1 month, 2 months, 3 months? Dr. Israel.
Okay. And if you treat malaria, one thing you should know is this: when you treat malaria with medication, it's not a preventive measure. And it means saying that the malaria when you get now you treat that moment. So if mosquito will carry the parasite when they cause malaria still bites you like 3 days later, and your immune system not doing strong enough, you fit still come down with malaria again. Eh? However, if you notice say you don't dey fall sick every time, you dey fall sick every time, it fit not even be malaria. So that one I mean say you need to go for proper checkup, proper investigation, make dem really find out why you dey always dey fall sick. And if dem fit find out and find out say na still malaria, another thing na to check your environment. um Where all dis mosquito dey, you need to make sure say you shift them, and you need to shift those mosquito away from you, because na dem dey carry the parasite wey dey cause, some of the mosquito na dey carry the parasite wey dey cause malaria. And if they suck on you, they fit still give you the malaria. So one thing when I two things when I don't talk, when you treat yourself, say you don't treat yourself, like as you talk 2 months, 3 months, and you not like her, go for better checkup. And if the system na malaria, you start looking inward. How is my environment? How is my hygiene level? Because all these things will make mosquito get that, as Dr. Fred talk, they'll breed, and then they carry that parasite when they cause malaria. So with that, you can actually treat yourself. Finally,
Yeah.
you know, go come dey fall sick.
And also, if you no get malaria for 1 year, 2 years, nobody say you must be treating malaria. Oh, you
At
don't
all.
be sick where I treat malaria. I want to take malaria medicine. It's abnormal. If malaria no do you for 10 years, you have no business with anti-malaria. It's not a must that you must be taking malaria medicine when you no get them for your body. There are people they never treat malaria for more than 10 years and they are fine. You understand? But if you know say every time you treat malaria, let a medical doctor um examine you, assess you, and find out what they happen. Okay, is there any final words as we round up tonight?
Okay, my final word is just make we try and make sure say we keep to these simple few rules when we talk today. And yes, it not really dey easy, but when you start to dey practice and they say practice make perfect. When you start to dey practice and you go you go like yourself, you go like yourself seriously, because then you no go dey fall sick anyhow, you no go dey get anything wey go dey stress you, and you go also reduce the amount of money wey you dey spend for sickness. And I go also wan say make we try dey wash our hands. It is very very important, and drink a lot of water. Water also get a own role wey e dey play for our body. When we take a lot of water, mostly when you see say the weather dey very hot, or the atmosphere, the weather dey very very hot, so you take a lot of water, and you go, in that way you go just dey prevent one or two things when suppose happen to you when you no know. Thank you. And I will also say una thank you for always being with us today. If not be you, we for not be here. Thank you.
Thank you so much, Dr. Israel. Thank you. Ladies and gentlemen, look at Dr. Israel's handle. Everybody follow Dr. Israel. Look at his handle. Follow him quickly. Everybody, if you watch me now, you hear my voice. Follow Dr. Israel on his page. And I want to say thank you for joining us. In addition, again, finally, our fruit challenge, the winners, we will announce them on the 1st of March 2024 by 8 p.m. Nigerian time. I beg, no miss am, because nobody will come to explain to you whether your name dey or your name not dey. No miss am, watch am. In addition, again, if you know say you participate for the fruit challenge, I beg, go and register your OPay account, because na OPay now I want you to send them, so that next one we go carry this matter go tell OPay, make dem come sponsor, so that we can give out more money. So everybody that participated, you recorded your video on your page, just go. I dey give you expo now. Go and register and open an OPay account down, because now that one I want to send the money, so that next week challenge, maybe OPay their head go enter us, go fit partner with them. You understand? Thank you so much for joining us. Um, I appreciate you all the people that sent stars, that sent super chats. Um, Somebody says, I would like you to speak on Ulcer too one day. We have done this a long time ago. Just go to our YouTube channel. We have done this program for about 4 years now. So we don't talk about many topics. Huh? So when you did less busy, go through the page or my YouTube page or Dr. Israel page. You will see many of the videos where we don't talk about many topics. This is like the fourth year. Every Sunday, God night they help us. So thank you for watching. Thank you for joining. Thank you for sharing. We don't take your presence here for granted. I always tell you, um, good life now waiting. Good life
Nonsense.
sense. Take care and bye bye.